Good morning, I'm Marta Gaia-Zanchi, and today we're here for a lesson on mobile health, industry overview and the evolving regulatory framework, brought to you by the Center of Excellence in Regulatory Science and Innovation at UCSF-Stanford. This course is structured in 4 modules, and today we're here to talk about Module 1. We will provide an introduction on mobile health and industry landscape. We will be talking about relevant healthcare, macroeconomics, and policy trends that are fueling innovation in this area, as well as an overview of the U.S. regulatory agency with responsibility on oversight on medical mobile health. We will then continue to talk about FDA's oversight of mobile medical health, going in deeper into key historical positions, oversight approach, the triangle of enforcement that the FDA decided to lay out for industry participants, as well as an overview of the mobile medical app guidance that was the very first and key piece of guidance created by the Food and Drug Administration, as well as several examples of mobile health devices. We'll begin now with an introduction, an overview of the mobile health industry landscape, as well as macroeconomics, policy trends, and a landscaping of the U.S. regulatory agencies involved in oversight of this area. First of all, an introduction. What is mobile health? There have been several definitions over the years. I'm presenting to you one that was presented in 2011. Mobile health as a provision of health services and information via mobile technology, such as mobile phones and personal digital assistants. The last 3 words probably cue you in on the fact that this definition is quite old, but it remains relevant today in that there is one common denominator, and it's the word mobile. I often refer back to this definition, despite the fact that it's now 6-year-old, as still one of the best descriptive statements of mobile health, in that it brings the emphasis on what it is that the technologies enable as opposed to the technologies themselves. Others remain that are very valid. A few years later, the second definition was presented of mobile health as the use of mobile and wireless devices to improve health outcomes, healthcare services, and health research. This one is also very valid in that it also adds to the previous description an emphasis on healthcare research and not just the delivery of services and information, as well as an emphasis on outcomes, which is what mobile health technologies are enabling to achieve in the latest decade. The approach we're taking today to understand the mobile health industry is to look at how it falls inside a much bigger industry area known as digital health. I'm presenting to you here an application-agnostic subspecialty analysis of the digital health landscape, of which the mobile health is a component. Unfortunately, this generally accepted definition falls short of presenting a very good framework for understanding how to assess the regulatory requirements that are attached to these sub-technologies and sub-applications of digital health, including mobile health. But it remains interesting in that it shows us how complex the space can be to analyze with a regulatory framework that is specifically intended to analyze the functionalities and assess risks and benefits of these technologies. Mobile health is very broad in the applications that it enables, and it has several areas of overlap with other enabling technologies in digital health area, including big data, telemedicine, and so forth. So don't be surprised to see several examples of these other disciplines as we talk about mobile health in the continuation of this lesson. A definition is due at this point of digital health. What is exactly digital health? This very broad and fast-growing health technology sector has a definition that is evolving as fast as the sector itself. Specifically, 1 year from its launch, the National Center for Universities and Businesses presented a first definition at the State of Relationship 2014 report of collaboration between universities and businesses. This independent and non-profit membership organization that promotes and develops and supports university businesses collaboration across the UK released a very popular definition of digital health that I'm reporting here as the involvement in the use of information and communication technologies to help address health problems and challenges faced by patients. Despite the fact that digital health is a relatively new area of development in health technology innovation, it's certainly not new. If we go back in time, we actually can find one of the very first definitions of this area, dating back to the year 2000, as digital healthcare as the convergence of healthcare and the internet. Digital health certainly isn't a new concept. The definition that was penned in 2000 belongs to Seth Frank, and it was presented in the Journal of Ambulatory Care Management. I believe there is validity to both, and they certainly are a testament to how the industry have evolved. Whereas the information and communication technology's primary platform back in the year 2000 was the internet, we're seeing today a richness of technology platform that enable digital health much richer and much more pervasive than it was just about 17 years ago. If we could, very relevant would be to be able to study regulatory concepts applied to digital health by looking at how it is functionally developed in areas of purpose. Here we have an interesting breakdown of what is enabled with digital health, and specifically with the provision of digital data across the changing landscape of healthcare today. Robotics, for example, is considered a part of digital health, and so is the much larger industry sector focused on creating platforms for electronic health records. The definition is so broad that sometimes it's highly impractical when has to discuss regulatory issues. We will try, therefore, to abandon an analysis of this area by functional areas, which would make it much easier, if you will, at some times to discuss what would be the application of certain regulatory requirements. But it does have one key advantage, which is to enable us to focus the rest of these lessons specifically on those technologies that are enabling the provision of healthcare services and information via mobile or wireless technologies only. Back to mobile health then. What is mobile health? An example of mobile health is remote monitoring hubs and sensors. We're seeing in the slides a very broad landscape of technologies that date back to the very first year of mobile health, 2009 specifically, to much more recent devices. CellScope, for example, is one of the very first startups incubated by Rock Health, a digital health accelerator and now a venture fund located in San Francisco. Things was one of the very first companies to sell products on the mobile health marketplace created by Amazon.com several years ago. And we're seeing here also an example of the very first mobile health technology plays by Intel, dating back to, again, the year 2008 and 2009, the Intel Health Guide. There was no such thing as mobile health back then, and it certainly has evolved into a host of solutions for monitoring and sensing that includes things such as baby socks that are able to monitor key vital parameters for a child, patches. We're seeing things as simple as scales, but also as complex as those devices that paired with the phone allow the continuous monitoring of glucose, for example. And others potentially very life-saving technologies, such as those that are incorporated inside bracelets and other wristlets that allow the continuous monitoring of children who suffer from epilepsy. Please don't let the fact that we are relying on many of these technologies for continuous monitoring to lead you into thinking that the Americans are quite ready to give up in-person visits with their care professionals. There is great enthusiasm on the part of consumers about mobile health technologies. However, they're most interested in tracking biometrics, scheduling follow-up appointments, having reminders, and the ability to discuss remotely any follow-up concerns to visits. But only a minority actually sees these technologies as replacing the in-person visits that they already have with their primary care physicians. In other words, we're looking at mobile health technology as an enhancement of our current abilities to receive care, services, and information, not as a replacement. Mobile health is also wearables. Wearables are addressing a broad range of needs in healthcare. There are fitness and wellness devices, devices for emergency response, disease monitoring, notification, medication alerts, measurements and tracking of various parameters. We saw most recently, for example, the last vestige of Body Media, the FDA-cleared consumer-facing wearable device company acquired by Jawbone in 2013, slip away as a testament of the fact that this area is extremely dynamic. Some of the companies that are shown on this slide, for example, are companies that no longer exist. Some of their products created the first years of wearables in mobile health, but they have failed to find a position in the market and meet a compelling need that demonstrates to be sustainable. Others, however, continue to live on and, if you will, are very futuristic today, as they were just a few years ago. We're seeing devices that close the loop on insulin management for people who suffer from diabetes. We're seeing many of these wearables embedded into everyday objects, including shoes, and some solve very complex functions. Some are very life-saving devices, and others instead continue to be targeted to simple functions. Pedometers as well seem to be continuing as one of the #1 wearable devices desired by consumers in the United States. I mentioned some of these devices actually becoming embedded in the fabric of our lives every day, and this is actually quite literal. Some of the most interesting devices are finding place into our socks and pieces of clothing with applications that initially were intended to those that are the fitness enthusiasts, but actually very interesting repercussions potentially for those that suffer from diseases, in this case bisensoria of mobility. Not to mention the fact that new territories are continuing to become available. It is still true that an overwhelming majority of these devices are abandoned, unfortunately, within a few months, especially those that we put at our wrists and take the place of the very old-fashioned watches that have become redundant since we're all able to see the time in our smartphones. The initial wave of enthusiasm was not met necessarily with a very long-lasting adoption and an ability to create behavior change in those that were utilizing these devices. However, they continue to be a very popular technology in the marketplace and one that continues to hold promise for a host of applications, spanning the spectrum from wellness to disease management. As you can see in the slides, surprisingly enough, the enthusiasm on the part of consumers for mobile health wearable technologies, and particularly smart watches, is not quite defined by one specific demographic group. And please remember these slides when we'll talk a little bit later about what are some of the opportunities, especially in regard to affordability in healthcare services and information. As you can see from these slides in a report by Rock Health, some of the populations that are most interested in utilizing these devices are not those that we associate with the millennial population and younger, but also the elderly. The utilization of these devices is growing truly across the age range as well. Wearables continue to evolve, with new technologies becoming available that allow the miniaturization of the sensing components of these technologies. We're seeing a popular article just a couple of years ago present on the opportunity for some of these technology to become a little bit more than tattoos that take place on our skin and become embedded in our bodies. And if this seems like a vision of science from the future, we're actually doing it already. At Stanford University, a scientist has demonstrated wearable electronics that they're able to stretch the limits of what we can do with medicine and healthcare type of applications using very simple patterns that are embedded in our skin. Enabling technologies come not only from the laboratories. We have a lot to learn from industries that are adjacent to healthcare. Gamification, for example, has become a very powerful component of some of the mobile health technologies that we're seeing today, paired with sensors and other devices that are newer on the scene. One sign that mobile health is here to stay is that we're seeing some of the most trusted brands by consumers in the United States invest significantly in the potential of this area. We are all very aware of Apple Watch, for example, whose sensing abilities go possibly a little bit beyond what is currently advertised in the models that are available in the marketplace. And we know that the consumer giant is very interested in investing into the health division of the company. Mobile health is not only a technology area with consumer-facing applications. There are several devices and software applications available also for only professionals. Those are used for training or are an adjunct to actually the time of delivering care within the hospital environment. A popular example from recent years, for example, has been the utilization of Google Glass in order to augment the interaction between the physician and the patient during a lesson. We have also seen a number of software applications become available that enable the viewing of radiological images on tablets and smartphones. And these all seem very pioneering just about 5-6 years ago, but is routinely utilized in current hospital environments today. Not only these applications open up interesting possibilities for individual consumers and physicians, they also open up interesting opportunities for population health management, with a significant majority of all healthcare stakeholders believing that these technologies can provide the granular data that is necessary in order to fine-tune population health management from a policy perspective. An example at this point will make it a lot easier for me to communicate what could be potential population health applications of mobile health-enabled technologies. Consider, for example, the Proteus Digital Health non-ingestible sensors. It is a sensor that is embedded in a pill. The pill is digested and it is dying during the digestive process, sends a signal to a patch that is worn on the body. The patch translates a signal to a tablet or a phone that records a time of ingestion of the medication, and over time is able to provide more information about the behavior of the person who's prescribed the medication. This is an example of mobile health technology that combines therapy and analytics and closes the outcome loop for individual patients with potentially very valuable health outcomes for the individual. Let's consider, for example, what it can do for a person with a very regular routine. We have a very clear picture of the ingestion habits for this individual, Maurice, and the exact times during days in which he's taking his prescribed medication. We're also able to see how another individual with very different ingestion behaviors is taking the pill. And obviously, we would expect potentially very different health outcomes despite the utilization of the very same prescribed medication by these two different individuals. And now, as a doctor is able to review these behaviors in comparison with the prescribed medication, potentially being able to enhance the decision-making process in regard to what the regimen could be moving forward for these two different patients. But now let's look at these behaviors on a population basis and see how much it is actually able to provide about the real-world utilization of a medication that could potentially inform drug design or the design of the clinical trials that test for the safety and efficacy of these drugs in the real world.